Hello, everyone, and welcome back. I'm Dr. Mary E. Alton, and today we're talking about a condition that affects millions of women around the world, but is still often misunderstood: endometriosis. Many women are told that painful periods are simply a normal part of being a woman. While mild cramping is common, severe pain that disrupts your daily life is not something you should ignore. Endometriosis is a condition where tissue that is similar to the lining inside the uterus grows outside the uterus. These growths are commonly found on the ovaries' fallopian tubes, the outer surface of the uterus, the pelvic lining, and in some cases the bowel or bladder. Just like the lining inside your uterus, this tissue responds to monthly hormonal changes. It thickens, breaks down, and bleeds during your menstrual cycle. The difference is that this blood has nowhere to go. Over time, this can lead to inflammation, scar tissue, adhesions, and chronic pelvic pain. It is estimated that about 1 in 10 women of reproductive age has endometriosis, making it one of the most common gynecologic conditions. Pain from endometriosis is much more than ordinary menstrual cramps. The misplaced tissue causes inflammation and can irritate nearby nerves. Scar tissue may cause organs inside the pelvis to stick together. This can make normal body movements painful. Some women experience discomfort only during their period. Others may have pain throughout the month. The severity of pain does not always match how extensive the disease is. A woman with mild endometriosis may experience severe pain, while another with extensive disease may have very few symptoms. The symptoms of endometriosis can vary from person to person. Common signs include severe menstrual cramps that interfere with school, work, or daily activities, pain during or after sexual intercourse, chronic pelvic pain that continues even between periods, pain during bowel movements or urination, especially during menstruation, heavy menstrual bleeding or bleeding between periods, lower back pain during your menstrual cycle, digestive symptoms such as bloating, constipation, diarrhea, nausea, or abdominal discomfort, fatigue that doesn't improve with rest, difficulty becoming pregnant. Remember, not every woman experiences all of these symptoms. Some women may have no symptoms at all until they begin trying to conceive. The exact cause is still unknown. Researchers believe several factors may play a role. One theory is called retrograde menstruation, where menstrual blood flows backward through the fallopian tubes into the pelvic cavity. Other possible contributors include genetics, immune system abnormalities, hormonal influences, inflammation. It often runs in families. If your mother or sister has endometriosis, your risk may be higher. Diagnosis begins with a detailed medical history and physical examination. Your doctor may ask about your menstrual cycle, the severity of your pain, family history, problems with fertility. A pelvic examination may detect tenderness or ovarian cysts. Imaging tests such as ultrasound or MRI can sometimes identify ovarian endometriomas or suggest advanced disease. However, imaging cannot detect every case. In many situations, the diagnosis is made based on symptoms and response to treatment. Sometimes, a minimally invasive procedure called laparoscopy is used to confirm the diagnosis and, in many cases, treat visible endometriosis at the same time. Endometriosis can make it more difficult to become pregnant. Scar tissue may affect the ovaries or fallopian tubes. Inflammation can interfere with fertilization and implantation. However, many women with endometriosis become pregnant naturally. Others may benefit from medications, surgery, or fertility treatments such as assisted reproductive technologies. If you've been trying to conceive for a year, or for 6 months if you're age 35 or older, it's important to speak with a healthcare provider. Treatment depends on your age, the severity of your symptoms, whether you're planning pregnancy, and the extent of the disease. Treatment may include pain-relieving medications such as non-steroidal anti-inflammatory drugs for symptom control, hormonal therapies including birth control pills, hormonal IUDs, progestin therapy, or medications that suppress ovarian hormone production. Surgery may be recommended to remove endometriosis implants, ovarian cysts, or scar tissue, especially if pain is severe or fertility is affected. Lifestyle measures, can also help. Regular exercise, good sleep stress management, a balanced anti-inflammatory diet, and working with a healthcare team experienced in managing endometriosis. You should seek medical evaluation if your period pain prevents you from attending work or school. Pain medications no longer provide relief. You experience chronic pelvic pain. You have pain during intercourse. You notice heavy bleeding or bleeding between periods. You've been trying to become pregnant without success. Early diagnosis may reduce complications and improve quality of life. Let's clear up a few common myths. Myth: painful periods are always normal. Fact: severe pain that limits daily life deserves medical evaluation. Myth: pregnancy cures endometriosis. Fact: pregnancy may temporarily improve symptoms for some women, but it is not considered a cure. Myth: a hysterectomy always cures endometriosis. Fact: some women continue to have symptoms even after hysterectomy, depending on the extent of the disease and whether endometriosis remains outside the uterus. Endometriosis is a real medical condition, not something women should simply learn to live with. If your periods are consistently painful, interfere with your daily activities, or are accompanied by other symptoms we've discussed today, don't ignore them. Early evaluation and appropriate treatment can help reduce pain, protect fertility, and improve quality of life. If you found this video helpful, please like, subscribe, and turn on notifications so you don't miss future women's health videos. Thank you for watching. I'm Dr. Mary E. Alton, and I'll see you in the next video.